topic that comes up a little bit about scenarios where we might see IOL dislocation after cataract surgery.
Well, it's interesting because when we used to do cataract surgery where we would location, but since our surgical techniques of spontaneous dislocation of the intraocular lens completely within the pseudoexfoliation or exfoliation syndrome, and that's location of the entire lens within the capsular bag.
Mm-hmm. And is the dislocation usually a superior inferior dislocation? Meaning, does it stay kind of planar, or does it tilt in a different axis as well?
You know, there's really no pattern to it. I mean, it can tilt, it can move in various different directions when that happens.
So how do we go about discovering this problem? Do patients present with symptoms, or is this something that's picked up on an ophthalmic examination?
Oftentimes, patients will present with some vague symptoms. They'll say, you know, my vision just seems funny. It's more blurry. I can't really see well. And then they'll often come up with something, and they'll say, you know, when I'm laying down, and then I first sit up, depending on their position.
So then what can we do in the, is not posterior to the iris and well-centered as it once was?
Place, the lens you can use, or totally off.
Performed just in the superior aspect of the
Still intact on one side.
And may have been intelligent enough to implant a capsular tension ring or some other capsular device at the time of that surgery. Does that then make the IOL bag complex fixation for you easier or harder later on?
It's actually, if anything, easier, but certainly not more difficult, because you can actually put either one will allow you fixation when you're trying to fixate it to the ciliary sulcus.
Do you think that there's any utility for prophylactically implanting capsular tension rings in patients who you may suspect could be at risk for late onset capsular
bag from constricting? And so we would have to do these. We have still found a large amount of them that have a capsular tension ring in them and still spontaneously dislocate. So I don't know the answer to that question, if it's going to delay it or if it's going to actually stop it.
Understood. Well, thank you so much for sharing your expertise on this and some great techniques on how to fix it.
Thank you.